This is Errol Marks from the Worldwide Sports Radio Network and Joba in the Mouth. We're here at Super Bowl 59, Radio Row. We're here with two very special people, Chris Nowinski and Dr. Dan. Chris, I saw you on the Chris Benoit special. Tell us a little bit about what you've been doing to help CTE and try to figure out how to cure it.
Yeah, 20 years ago when I got concussed out of the WWE myself and got to know Chris, I realized that this stuff is much worse than we realize. And so I started the Concussion Legacy Foundation in 07, the Boston University CT Center in 08, and we've finally started to wrap our arms around what is this chronic traumatic encephalopathy thing. We worked with my colleague, Dr. Daneshvar here from Harvard. And basically what we now know is that for Super Bowl week, we've now looked at the brains of nearly 400 NFL players, and more than 90% have had this disease. And it's a huge chunk of all those who have died. And so basically it means like CT is rampant throughout football, throughout the NHL. We still know how to diagnose it in people, which is why we're studying brains. We still know how to treat it. So it's a big problem that no one really wants to talk about here, but we're here to talk about it.
Dr. Dan, Chris was telling me so many great things that you've been doing and trying to figure out how we can figure out a cure. The NFL has been trying to figure out how to protect the heads and opportunities maybe to figure out what's the difference between turf and grass. When you look at the game and the transition of the game and protecting some of these athletes from being hit in the head, where do you see the growth of trying to figure this out?
So it's unquestionable that it's gotten better in terms of protecting athlete health at the NFL level. That doesn't mean there's not a lot of room to improve. But what we're understanding about CTE and brain health long term is that it's the cumulative number of hits to the head and the force of those hits that increases your risk of having problems later. And any effort that decreases the number and force of those hits is going to be beneficial for a brain health perspective.
It's unbelievable because I've seen so many athletes go down this year. How many times did we see an athlete go down? A hockey player recently went down, got hit in the head, he got up, and then he fell to the ground, and he wouldn't get back up. How do you know the rate, the scale of the injury, the concussion, when somebody falls down and hits his head?
It's actually difficult to tell immediately at the time of injury how severe the concussion is going to be, because the symptoms when you get hit don't line up well with how your recovery ends up being. So the best way to tell, unfortunately, is after the fact, by looking at how long it took to recover. So that's an unsatisfying answer, but we're looking at it from a biomarker standpoint, from an imaging standpoint, other ways to tell, but none of those are really panning out quite yet.
Chris, you look at all the different sports, obviously wrestling, obviously entertainment, hockey, football, basketball. Basketball players get concussions. What do you see the game and the transition of how they can look at the game and try to figure out what really causes concussions in so many, in that kind of category?
I think what we've learned is the sports have gotten more ethical. So we now tell the athletes what a concussion is. And now when they show any signs of concussion or they say, hey, my head's not right, they're not going back in. And so that's a great thing. And so the NFL had the lowest concussions they've had in 12 years. So we can all be very happy about the changes that have been made. And that does trickle a little bit to your kids. The problem is addressing the concussion issue is not going to address the CT issue necessarily. See, as Dan said, the CT issue is accumulation of hits over time. And one of the interesting things that we've been talking about this week is that, okay, the NFL is now a little bit safer, right? Concussions are down, but that doesn't mean that we should expect any fewer CT cases going forward among NFL players, because we're not also making the changes like to the kickoff and other things at the lower levels of football. College, high school youth are not as proactive as the NFL is. And so we need to inspire them to say, hey, we don't need to be hitting in practice. And, hey, maybe our kids don't need to be taking 500 blows to the head when they're 5 years old in youth tackle football, because that is going to create CT in some of those kids. And it's a disease you don't want. Just earlier today we announced that Conrad Dobler had CT when he died. So he was known in the 70s, 80s, the dirtiest player in the game. Died at 72 of dementia, and he had a rough last 10 years of his life.
Dr. D, I've been arguing with the NFL, and I've said it many, many times, and I'm sure the NFL has heard some of my crazy takes on turf and how turf, I believe, could be a very big cause, and not only physical injuries to the body, but to the brain. What do you see? Do you think the NFL should transition and try to make all the fields grass instead of turf? And have you seen the difference in the reaction of concussions because most of the stadiums now are turf?
So there's quite a bit of research now looking at the ability of turf to absorb a force compared to grass. And there appear to be some differences between those two. But when we're talking about the risk long term, the amount of difference between turf and natural grass in terms of the force absorbed isn't a huge factor when you're considering the fact that you have 300-pound men running at really fast speeds and hitting each other repetitively. Those forces might be attenuated marginally, and certainly it's important to look to see if there are benefits orthopedically and neurologically to one type of equipment or turf or any other kinds of interventions. But we don't really have enough data, and it's not really going to move the needle as much as eliminating head impacts, as Dr. Nowinski said.
I'd like to add to that, if I may, to say the other question is when you compare grass to turf, it's not that's not the way to think about it, because turf is designed differently. Some places use different types of turf. Some people are putting shock pads underneath the turf, some aren't. And some people are doing a good job maintaining the infill and others aren't. And so it's not just a question of turf versus grass, but it's how you design the turf and then how you maintain it and the grass. And the reality is in the U.S., we have a different standard for turf than they have in Europe. It's allowed to be much harder, and that's a terrible thing for the players, but it's good for industry because it lets them probably be more profitable when they lay it down. And so we tried to dig into the turf problem 10 years ago and draw attention to this, and it got squashed. That's a rough business, and so it's a shame that the players are the ones suffering because of it.
Now, obviously I don't study CTE like you guys do, but I've seen so many different things that have happened to players after them getting CTE. What are the things you look for when you're having a concussion that you can see that could be a cause or the beginning of CTE?
Well, I'll lead to Dan, because Dan's treating people, but the important thing is separating concussion from CTE. Mm-hmm. Concussion is just an acute brain injury that you're going to get better from over time. CTE, the reality is some of those hits, whether or not they cause you symptoms, are sparking CTE. You won't feel it, you won't notice it until your brain is rotted for 10 or 20 years, and then you have symptom onset. So they're very separate issues, but then we're always sending people to see Dr. Daneshvar to get treated. Now I can talk about what you see.
Well, so what we see in terms of concussion is prolonged symptoms like headaches, dizziness, nausea, problems with thinking, problems with memory. And when those things persist, we can get in there and actually help them get better. And that's what happens in the acute process. But just to echo what Dr. Nowinski just said, if for every concussion, based on helmet sensor data, a person gets 341 hits to the head that are of equal or greater force than that force that gave them a concussion. And so concussions are the symptomatic head impacts, but all 342 of those head impacts are what matters when it comes to CTE long term.
And people will start to show problems. It usually splits. Some people, their first symptom is memory problems, executive functioning problems. They don't make good decisions anymore. Their judgment's off. They get impulsive. And then the other part of that is really, you get a lot of behavioral issues. You get mood issues. You get that, you see a lot of gambling and addiction and sort of strange, aggressive behaviors with family sometimes. So when these are happening sort of after football, midlife, out of nowhere, you hear about personality change. That's very frequently CT, although those symptoms still are treatable. They're not always going to just get worse. And it's interesting to talk about that when you think about, have you been following the Hall of Fame this year with Jim Tyrer?
Yep.
So it's a story that people don't know, but it's a really scary one. Because we didn't start studying CT until 2005 was the first publication. But in 1980, a person who's up for the Hall of Fame right now, Jim Tyrer, 9-time All-Pro, best tackle of his generation, one of all best all time. He struggled after he retired. He, at 40 years old, his wife took him to the doctor, said he's losing his mind, he's got all his memory problems, and they set him up for a psychiatrist on Monday, and on Sunday, he shot and killed his wife and killed himself. Had this happen now, we would all say he's got CT, we'd study him, and I'm 99.9% sure we'd find it. But back then, they just thought he lost his mind. He lost his mind, he missed the spotlight, whatever it was. So now he's up for the Hall of Fame because people understand that, but I would suspect the NFL doesn't want him to go in because then they have to talk about this murder-suicide like the Benoit situation forever, but it's exactly the same as the Benoit story.
Dr. Dan, you've seen a lot of brains, and you've seen a lot of athletes' brains with CTE. What is the worst brain you've seen so far in your time of studying it?
So CTE is a progressive disease, and so the worst brains are the ones of people who've had a lot of exposure to head impact, so a lot of years of contact, and that lived a long time. You end up seeing, unfortunately, widespread atrophy of the brain, which is basically the brain tissue has gotten so diseased that it's died and shrunken. and we see 20-30% of the volume lost in those brains, and people end up having a lot of very severe dementia and other problems.
Yeah, we don't want to speak. There is one case that people can Google and find the image of where it's almost completely brown and it shrunk by more than a third. It was a Hall of Famer. We don't give the name, but it was pretty scary. And then you go back and like Aaron Hernandez was actually the worst case we've ever seen of anyone in their 20s. Yeah. Another person who committed multiple murders. We thought when we got the brain, it would just see a little bit and it wouldn't explain why he changed so much. But then we saw it. I go, at stage 3 in your 20s, when he stopped playing at 24, that is going to change everybody's personality, everybody's decision making. And I think without CTE, he might have still been playing.
I don't understand it because there's so many athletes and so many people that have CTE. The next thing, they get to that level where they're killing people and they're destroying people's lives. What is it that happens to the brain that causes this situation?
I'll answer that because I can get in trouble and you shouldn't. My operating theory on this, having seen this for 20 years now and following all these cases, you can't ever blame CT on one act. Mm-hmm. Every situation like that is very, very multifactorial. But basically what you can say is that if your brain is rotting, your frontal lobe is damaged, your amygdala is damaged, which controls fight or flight, and your brain is going wacky, when things go bad in life, you are not going to respond to stress normally. And so basically, I think all of us are capable of losing our minds, but basically like the odds of us getting to that threshold, we're going to stay down here. But with CT, maybe that there's one day where you get over that line where you feel like murder is appropriate. Or to maybe take my life, this is the day, and it makes sense. So I think you're just less resilient to the hard parts of life if your brain is falling apart. Does that make sense?
It makes sense.
Generally?
Yeah, basically damage to your brain doesn't help you make better decisions.
Well, that means I probably have a very damaged brain for some of the crazy stuff that I do. But as an athlete, a former athlete, I played hockey for many, many years. I was actually on a pond recently, and I said it on my show. I was skating. I hit a rivet in the ice. I skated backwards fast. I stopped, and I fell, hit my back, and then landed on my head. And I got up. I wasn't dizzy. I have a friend that's a doctor. And what do I look for in a concussion? You could be looking for a lot. Do you have a headache? I said, I have a headache, but it's not a major headache. Well, that doesn't mean that you don't have a concussion. It might be a slight concussion. And then as the days gone by, I was just, the headaches were starting to move in different parts of my head. So I never got it studied. I never went to get a CAT scan. One of the main reasons why is because I had kidney stones, and I had to get my kidney stone scanned. So they tell me not to go and not to do back-to-back CAT scans because it could put
too much radiation.
Too much radiation. So I didn't do it. I look at the game. I wonder with hockey. That's what I worry about more than anything because hockey is a board. They get slammed in the boards. It doesn't move. And I see these guys, they fall down, their eyes are rolling in the back of the head, they get off. And I think with the NFL, I think they do a good job now that if they can't get up or they see them not get up quick, that they have to go into the tent. Hockey players still are sitting on the bench, they put the lights in their eyes and they're back on the ice.
Yeah.
So what do you think the NHL could do to help this, help the players out? That's something that the NFL has done over the last couple of years.
Well, I think that anything, again, that can reduce these unnecessary head impacts is going to be beneficial. So reducing the contacts in practice is going to be beneficial. Improving the ability to evaluate. I mean, we're asking our athletic trainers, our physicians, our clinicians to do a really hard job by standing on the sideline and getting a sense of what's going on in someone's head, yards away. Mm-hmm. And that's tough enough in a chaotic environment underneath a tent. Imagine in an even more chaotic environment, trying to pick up on something subtle is very difficult. So being able to get the time to evaluate people and then to reduce the number of hits are going to be beneficial in terms of concussion.
And I will say that it's ridiculous that the NHL won't acknowledge their game causes CTE. We just published that 18 of 19 NHL players we've studied have had it. And Gary Bettman needs to be honest with his players and all the hockey players in the country. This is possible. It's from the ice is harder than any surface in football. When your head hits the ice, it's causing serious damage. So that we can at least have a conversation about how safe we want it to be.
Before we let you go, I know you both are football fans. Dr. Dan, you first. We're going to Super Bowl 59. You have the Kansas City Chiefs, and you have the Philadelphia Eagles. You watched the games. We saw what happened against the Bills in the fourth quarter. It looked like everything was going perfectly until the fourth quarter when all these things started to happen. And a lot of people are pointing fingers at the NFL. I'm putting my hands up because I've been saying it for the last couple of years, and now everybody's saying. I was the first person to say this 8 years ago on my show, and and people can quote it. I said that the game is rigged. If the NFL is trying to find ways to help other teams get to the place, and it's not just the NFL. The NBA does it. The MLB, the NHL does this. Okay? So my thought to you first, Chris and Dan, you look at the game. Do you believe in some kind of way they're rigging it?
I will say paranoia is a symptom of CTE.
Well, I guess I have CTE.
I don't think it's WWE, but I understand how people can put their thumb on the scales. But listen, I trust the NFL implicitly. After battling them on CTE for 20 years, they always make the right.
Well, I'm not going to say. I plead the fifth.
and I'm still mourning the loss to the Lions, so that's my home team. So.
Well, you should. But guess what? We got Aaron Glenn. I mean, I'm a Jet fan. The Jets got it right. They finally bring in an actual Jet to run the team. So I'm happy about that. I'm just kind of a little washed up that Aaron Glenn came out and said, hey, we don't know what we're doing with Aaron Rodgers, which probably tells me in my head they're probably bringing him back. That doesn't make any sense to me. But, again, this is the New York Jets. But your thoughts, I'm going to go off that because I want the Jets to kill me. They've already said some crazy things about me. But your thoughts to the Super Bowl. Who do you got, both of you guys? Who do you have in the Super Bowl and why?
We're scientists that study this. We're not fans. Neither one could beat my 85 Bears. That's all I got to say.
Oh, well, that's a good answer. I remember the 85 Bears. I was actually 3 years old when they won the Super Bowl. That just tells you how much older I am to these guys over here. I'm older. So when you were born, I was 7 years old. So there you go. I'm an elder. Anyways, guys, I really appreciate you guys I know you guys are very, very busy, and I'm a big fan of yours. I've watched you, and I'm a big fan of yours. I've seen all the stuff that you do, you put out there and trying to help with the CTE situation. I am completely discouraged on some of the things that I have heard from different players in the past, and even ex-players I believe the NFL should be helping out with some of these younger players, older players, because they have been the past and what the NFL has really transitioned to. So I appreciate you guys because you guys are honest, you're straightforward, and especially you. I've checked out all the stuff that you put out there, and no matter what anybody has said about some of the things that you said, I have absolutely agreed. And when he just told me that he had you, I was like, I know who he is. I watched the Benoit story, the documentary, which is amazing, and what you did stepping in and you telling Vince McMahon that things need to be changed. I think it's absolutely amazing what you're doing right now for the game.
I appreciate that.
Absolutely. Thank you guys for joining us.
Thanks
for having us.